Welcome to my YouTube channel. This is Dr. Nambi and I'm going to be continuing with my health series with my health tips. If you haven't subscribed on my YouTube channel, please consider subscribing on my YouTube channel. So if you don't know me, I am Dr. Nambi and I'm a medical doctor. I'm a motivational speaker, inspirational speaker. I'm an author of a book From Ghetto to Doctorpreneur. I'm a mother, I'm a wife, and on this channel we do everything from motivation, adventure, we do your health tips, we do business talks, basically everything that concerns your life. I just cover all the topics and we just counsel you and we guide you so that you can make the right decisions in everything or every area of your life. So let's get right into the topic of the week, which is depression. Depression is quite major, and because it's quite major, what I will be doing this week is I will just be covering your major depression disorder, which is, in short terms, medical terms, we call it MDD, major depression disorder. So your depression can come in so many ways. There's a lot of causes that can cause your depression. It can be work-related stress, work-related pressure, it can be family pressure, financial pressure, it can be sickness, it can be a death of a loved one, it can be, a relationship that has failed, or things that are not working out in your marriage or your relationship with your children or your partner. So it can be broad. It's a lot of things that can cause it. Even money can cause, depression. So most people overlook depression, and depression is real. I just want to tell you that if you are going through any form of depression, I don't want you to be silent about it. Find help as soon as possible, because if you leave it, it might be too late. And we've seen people who have gone to the extent of committing suicide just because of depression, just because they were not able to cope with the pressure that they were facing. So I'm just going to be talking more in details about what exactly do I mean when I talk about depression. So especially when we mean major depression disorder, is usually when your mood is very down or depressed, and this can be ranging up to a duration of 2 weeks where your mood is just very, very down. You are depressed. You lose interest in things that things that are supposed to ignite your passion, that are supposed to interest you. You lose interest in those things, and that's what we say. If it goes for 2 weeks, that is already a sign that there is depression. But it's not only that. There's also other symptoms that come with your depression. We have your somatic symptoms, which I will explain in your layman terms, which is not medical related terms, and we also have your psychic symptoms, which also I will explain in broad so you understand in non-medical terms. So your somatic symptoms are usually the person has a change in their appetite. So the appetite can either be increased, so it can be they are eating too much, or they are not eating at all. So basically eating too much can be a problem. Eating too less, especially for somebody that we know is supposed to be eating, and that person is continuously for 2 weeks skipping meals, not eating, that is already a sign something is wrong. And then, someone who usually doesn't eat, now suddenly this person is eating too much. That is already also a warning sign. So watch out for those signs, because you can pick up in the way the person is eating that this is not the usual routine, this is not the usual way this person usually eats, and then you can respond according to that. So that is number one symptom of your somatic symptom. The other symptom is there's a change in the pattern or in their sleep. So changing, either they sleep too much, so they don't want to go to work, they don't want to go to school. You tell them, let's go out and do, some fun activities. They don't want to do any of that. that is already a warning sign. So either they sleep too much or they don't sleep at all. We have seen people when they're under a lot of stress, the whole night they are awake, they can't even sleep. You have to already say, oh, something is going on here. And the other symptom, they are easily agitated. Anything small, they are already, like a little bit angry, and that's not normal. So, and the other thing that we've seen is the energy level also goes down. Maybe this is a very hyperactive person. Suddenly you see that they are very down. The energy is not there. When you greet them, hello, and they're like, hello. Like something is not on. When I greet Dr. Nambi, usually the way she answers is with, lovely, loud voice, and suddenly the voice is not loud, the voice is down, the smile is not there. You have to already be conscious that something is going on. So you can have either one or two of those symptoms. So either their appetite has changed, their sleep pattern has changed, they are agitated, they don't have energy. Those are the symptoms to watch out. If you have anybody in the house, watch out for those symptoms, and please be able to reach out to them as early as possible. So those are what we call your somatic symptoms. Your psychic symptoms is usually symptoms like, feeling unworthy, feeling very guilty, feeling like they want to commit suicide, they want to die, like they don't, no matter how many problems they have, no matter how many solutions you want to provide and help them with, they still don't want to, be able to change. They just say, I want to die. I want to die. And they just give up. And already there's a major problem that is going on. And then if let's say that person is a student or is working, and then you've seen, but this person is a person that I've known that usually, is so concentrated on the work. Suddenly they don't have that concentration. Already, also something is very wrong. So be able to reach out as soon as possible. So my top recommendations, mental health is real. Mental health is very real. Depression is very real. I just want to encourage you, no matter what you are going through, don't hold it in and say, what, I cannot reach out. I cannot talk to somebody. I'm in this problem alone. I want to encourage you to say, no matter how big you think that problem is, reach out to somebody and see how that person can help you overcome that situation that you are going through. So first of all, reach out for family support. If family support is not there, there's nobody that can, help you in the family. Look out for a friend. Look out for a colleague that you can trust, a schoolmate that, that you can confide in, a partner, your husband, your wife, your girlfriend, your boyfriend. If you can trust them enough, talk to them, your pastor, your priest, talk to them and tell them, I'm going through 1, 2, 3, and then see how they can counsel you through that problem that you are going through, because this is real. And I'm talking about people, end up dying because they are bearing things in them and they can't release them, and we are not there to support them. Unfortunately, we leave them with all those problems that they are going through. So that's why I'm saying number one is, recommendations or tips on overcoming your depression or mental health is actually as family to take note of those symptoms that I mentioned and to reach out to somebody. Even if you don't have to do much, I always say if you can be an ear, just be that. The next step is to reach out to your GP. I have patients that have come to my surgery, and I don't even, qualify to say I'm gonna be, like a psychologist and counsel them. But what I do is just listen. Listen without even mentioning or doing much. Once I've done the listening, then I'm like, how do I help? And then the next step, I'm like, what? This is not going to stop here. I can give you my 5 cents of advice, but I still feel you need to be seen by a specialist, either a psychologist, either a social worker, either a psychiatrist. They will help you to cope with that family issue that you are having. And most of them, they listen. When I tell them go and, consult with the psychologist, and I give them a referral, they do go and they survive. And that is because the first step I did was not actually to judge, but be there as a form of support. Be there to help them as they are accepting whatever situation they are dealing with. And then I'm like, don't worry, whatever that you are going through, you are not alone. We are with you through this process. And I make sure that we are really there to support this client. So once you go to your doctor will counsel you and also, be able to make that diagnosis, the diagnosis of, is it really a major depression disorder? Is it a bipolar? Is it schizophrenia? Or is it any other mental related, health illnesses? And then your doctor, once they make the diagnosis, if they see that the signs or the symptoms that you are having, they are very severe, then your doctor will start you on treatment. The first line that most doctors or us doctors we give is amitriptyline. If it's not amitriptyline, we give your tretinoin. So the tretinoin is just 25 milligrams. It's once off. You drink every day in the night for about 1 month. Within that 1 month, if there's no improvement and that tretinoin is not working, the next step is usually now to refer to your psychologist or psychiatrist, and the psychiatrist is the one who's going to prescribe your mood stabilizing medication. Sometimes they can give you 1 medication, sometimes it's 2, sometimes it's 3. But my advice on this, once you start on those mood stabilizing medication, you can't stop it. You might have to take it from 3 to 6 months. Sometimes you might even go to 1 year before you can stop those medications, because the side effects can be, too much. So don't stop it just because you feel like, I'm okay now and I don't need medication, I'm fine now. You can relapse, and then relapsing might mean that you might get into a severe major depression that can cost your life. So that's why you don't just stop the medication. Go back to the doctor who started you the medication, and the doctor will be able to stop that medication that you have been given. I hope you do understand that part. And then the other part that obviously, the psychologist or the psychiatrist, they do is psychotherapy. So this is just, they do your behavior type of therapy. They do a lot of things just to study and see what is going on and what is causing this problem. The other thing also, they do your stress, management. They try to see what is the root of this stress that you are having, or the root of the depression that you are having, and how do we eliminate that root of the problem. They start in that way. By so doing, they are able to help you so you can cope with your depression. You can be able to face that challenge that is causing that depression and save your life. So that is my tips on your depression. I just came in to give you advice that you are not alone, no matter what you are going through during this hard time, COVID times when the finances are not doing so very well, businesses are not doing so very well, your studies might not be going so very well, your family relationships might not be going very well. I just want to come in and encourage you and say you are not alone. We are here with you. We are also dealing with issues on our own. So I don't want you to feel like, this is, only you that is going through this situation. So hang in there. There is help. There are people I know that are dedicated to help you to get out through this problem. And then if you have any questions, please do comment down below and I will be able to answer all your questions. And next week, I'm also going to give you my one-on-one on how I was able to, my depression story, what I went through, what caused my depression, and how I was able to cope with my depression. So that's why I came with this topic, so that you know that even me, I do go through depression from time to time. And even me, I go through a lot of things. But I had one point where I had just hit rock bottom, and things were really tough for me. But that is a topic for next week, where I will give you my example of my journey to overcoming depression. Don't forget to like and subscribe my video. Thank you family for the support. Don't forget to share this video to somebody who might need this video. Thank you so much. I will see you. Dr. Nambi signing out.